This is one of the new CGIAR research programs, most of which are approved, but not all yet approved. This one was approved on a no objection basis late December, and we started in January. So you're going to see how far we're getting. Now, Jonathan kind of gave the overview of the different, kind of the what parts of this. So there's a part looking at enhancing nutrition along the value chain, and Laurian's the leader. Biofortification with Howdy, prevention and control of agriculture-associated diseases with Delia, and then how this kind of comes together in terms of our clients and partners in terms of integrated programs and policies. And I guess the kind of big departure here is that kind of as agricultural research community or as the agriculture community, we're trying to claim all the time a lot of nutrition and health benefits from agriculture. And I think there's a lot of evidence that we can feed people. I'm not sure how much evidence is that we can nourish people. And I think that's one of the challenges that this is. So we see kind of one of our major clients is the kind of agricultural community to say, how can we actually do a better job of articulating what it is that we can deliver for nutrition and health, which are all important things that people care about. So that's really the why of why we're doing this. How can agriculture do a better job to deliver on nutrition and health? And what can agriculture do, and what does it need other parts of things to do as well? Now, we're starting out, like most of the CGIAR research programs, with an initial position. And that initial position is a portfolio of work of about $58 to $60 million this year. Now, more than 75% of that is restricted grants that have already been achieved by the different chief stakeholders in the group, and most of them are sitting here. Okay, so it's, in a sense, it's kind of a consortium or a stakeholder model that we're trying to align moving forward. And we have some big pieces. So biofortification, as Jonathan said, has been going on for some time. It's been kind of the model of how to get centers to work together, how to work effectively with research and development partners, and it's been extremely well managed. So one of the benefits of having it with us is that there's a lot we can learn about running these kinds of programs from Howdy and his team. Then we have agriculture-associated diseases, which is something that has been going on for some time, probably a similar amount of time to biofortification, but maybe funding at kind of 8 to 10% of the level. With some interesting findings around zoonotic diseases, and I think a very interesting body of work around food safety, how it works in informal markets, and how we need to look at risk-based approaches and use different kinds of incentives to make things work for the poor, which is an important part of this agenda. Then we have the whole area of integrated programs and policies. Marie and her team have quite a large body of work looking at agriculture, looking at nutrition interventions, looking at social protection programs, and how they fit in, and she can speak very well to that. There's quite a cohesive program there. And then something we're really starting is all the interest in value chain work across agricultural research and development. How do we look at how it does a better job on nutritional quality as well as food safety? And that's the kind of the task that Laurian's taken on, and that's really more in the beginning stages. Now, I guess even more than other CGIAR research programs, we recognize that we're just a small player trying to catalyze, integrate, support others. And we really look at this kind of complex field and see how does that look. Part of it is, obviously, we're a research organization, and we're working with other researchers because the breadth of this is quite broad in terms of particularly things like technologies, diagnostics, and other technologies that are important for this, in which there's a whole array of work going on in the world, not much of it in the CGIAR. Then there's a whole group of kind of policy work that largely engages with, you know, people that we've worked with before, and a lot of work on kind of institutional arrangements, incentives, et cetera, on the research side that's quite important. Okay? Then the other key partnerships who are actually the people who are delivering outcomes and impacts. Okay? And you'll see that we've got 3 groups we're targeting because of the 3 impact pathways that we're working through in terms of how agriculture delivers on nutrition and health. The first is through value chains, so we need to work with value chain actors and representatives. Okay? And often we won't do this on an individual basis, but we'll do it through other groups, whether they're other CGIAR research programs, other kinds of NGOs, or other groups who are organizing value chains, or obviously the private sector and groups that work with the private sector. GAIN, World Economic Forum, people like that. In terms of development implementers, obviously governments are doing a lot of these programs, NGOs, UN system, and others. How do we engage with them to give them the kind of evidence and other things they need? And the last group are the people who enable things, the policymakers, the investors. How do we form a partnership with them? So these are the key kind of how we see at a broad brush the partnerships. But they're all engaged in kind of moving towards impact pathways. I guess the big kind of change, one of the big changes in the CGIAR research programs is how do we orient these more towards outcome and impact so that the research is a greater service, a greater support to development outcomes and impacts. And we're trying to do it through 3 pathways. One is through value chains, one is through development programs, and one is through policy making. And I would like to go through each of these in turn and talk a little bit about who the key actors are, what we see as some of the issues, and what we see are the important areas where research can contribute to the overall outcome and impact pathways. So the first is around value chains, and the actors, though many, it's pretty obvious. I mean, one of the nice things about the value chain paradigm is that it's really clear about who needs to do different things in the whole process from input supply into agriculture all the way to consumption. And some parts of the CGIAR, the CGIAR has been better able to deliver on the parts in red, for example, and particularly the first 2, kind of input supply and farmers. Once we get beyond the farm, we're a bit weaker. But these are absolutely critical in terms of delivering nutrition and food quality to people. So first we have the kind of actors. That's one given. Okay? Another given is that we have some impact goals that we're supposed to be contributing through. And these aren't necessarily ones that we've come up with. These are Millennium Development Goals. These are goals that the international community has come up with. In overall nutrition, and Marie can talk to this more, we've got real goals now around the 1,000 days and what we do to mothers and children, what we do about stunting. Okay? And there's a real international commitment to this. Now, agriculture is placed to help with this, but the kind of targeted work is sometimes a challenge, and we can talk to later. But those are impacts that we're looking at. Decreased disease rates. Infectious diseases are particularly important in low and middle income countries, and so looking at how to do that, and a lot of them are from foodborne infections, waterborne infections that agriculture is associated with. Okay? So that's on the kind of impacts. The part we're really trying to nail down in this first year are what are these intermediate outcomes that take us to impact, because if we're to measure impact, that's so long term that we need some milestones along the way to guide us. And some of these will be around the performance overall of agriculture and food systems, and some of them will be around the performance of specific parts of those systems and how they're working, whether it's regulators or local market agents or people providing information to consumers. Then in terms of who do we engage with on the research side, there's a whole group of people who are involved in commodity value chains, many of the CRPs that are already in the CGIAR system, other groups and initiatives that are working on kind of commodity value chain approaches. Then we have a smaller group of people who are looking at kind of nutrition and health around value chains. And then we have a group of people, including the other CRP that IFPRI leads on policies, institutions, and markets, that are really looking at in a detailed way in terms of value chains, in terms of incentives and institutional arrangements for what works. So we want to piggyback on all those, many of which are linkages within the CGIAR itself. And then we have specific questions and some assumptions around how we're going to have impact. I think one of our assumptions is that we want to focus on value chains for nutrient-dense foods. Okay? Given the diets that we see in low-income countries, If we're really going to deliver for children, these have to be very high quality diets if we're going to deliver the nutrition that we need in the 1,000 days window. So that's one of the focuses. Okay? The other focus in this kind of value chain work is on informal markets. What are the markets that matter for the poor? Okay? I think private sector supermarket chains, they're largely handled by other people. Okay? But what can we do for informal markets and this transition or evolving markets from informal moving forward? Another one is that probably some of these things are going to need help. What's the role of public investment in kind of potential for demand pull mechanisms, and how can we get smallholder farmers engaged with small agents in these informal markets to move things forward? How can we get people excited about getting involved in markets, in value chains? And the other, I think, big research question is what's the potential for consumer education, for health education, for linking with public health? And I think that's very much an open question, but one that's worthy of exploring, given all the problems we see in quickly moving from undernutrition to overnutrition, for example. Okay, so that's some of the issues we're looking at in value chains. What about programs? Well, in programs, I guess the client group for research is pretty obvious. Okay, these are the governments, NGOs, civil society who are actually trying to deliver programs. Okay, where do we fit in? Well, we talk about integrated agriculture, nutrition, and health programs, but they're really probably agriculture nutrition programs and agriculture health programs. And we're looking at the kind of support we can provide to the clients who are delivering these, implementing these programs. But we're going to get a lot of feedback and learning from them in terms of how we restructure our own work. Now, I think one of the big questions we're exploring is, what can agriculture do? And kind of what can't it do? So when do we drive an agriculture program? And when do we have to supplement that with other kind of direct nutrition and health programs? How can we take advantage of food assistance, which is quite common? How do we look at cash transfer safety nets? And there's a lot of work in this program and linked to the Policies, Institutions, and Markets program, looking at how these can come together in different contexts in low and middle income countries. Third part is there's a plethora of research questions that are important to program delivery. What's the context for these? And I'll come to this in the policy discussion as well. What are the kind of best knowledge inputs and tools that these clients need? When is agriculture sufficient, and when do other levers need to be used? What's the kind of evidence for investments? I think we heard in Delhi more than a year ago that this was one of the crucial issues. What's the capacity of clients? What are the appropriate levels of monitoring and evaluation? Are we going to spend 35 or 40% or 25% of every program on evaluation? I don't think so. So what's the appropriate level? How can we lever and look for something that we can all agree on? What does it take to go to scale is the big question that people have as well. Okay, so this is kind of our thinking around the program impact pathway. Then we have policies. One thing I'd like to talk about is that the countries we're trying to serve or work in, they're not homogeneous at all. They're very different. And I think one of the nice things about the World Development Report in 2008 was to make this distinction between agrarian societies, transforming societies, and more urban and industrial societies. And I think that's a very good way of talking to policymakers in different countries about where they see themselves, how they vision themselves moving forward, and what's appropriate in this dynamic and evolving context. So that's kind of a context piece. Then we have this huge mess of kind of agricultural policies, health policies. Sometimes nutrition policies are linked to health policies, usually not. And then how this fits in with the broader policies that you people are dealing with in terms of economic planning and development, social policies. So how does this all come together? And it doesn't come together very well now because everybody speaks a separate language. And in a sense, all these things are competing with each other in some ways. So this is one real challenge that we want to look at. The other is that these things take place at a lot of different levels. Obviously, countries are still the kind of most important level. But for example, in sub-Saharan Africa, we're dealing with quite a few small countries. How can they be supported by some of these policies in terms of COMESA or ECOWAS, for example, which are becoming quite effective in terms of doing this? And what's the role at the kind of international level in terms of policy support? And then some of the questions we're exploring in this pathway. One is to really look at, and it's probably going to be for a subset of things where joint actions between agriculture, nutrition, and health will be more valuable. What are the kind of cross-sectoral arrangements, processes, and incentives that can make those joint processes work? How do we evaluate existing policies and implementation as we move forward? And often what happens is you start in an agrarian situation where a certain type of policy may work, like India in the 1970s, and you move to a middle-income country status where those policies and their context are really changing. So how do we look at that? What are the kind of measurement and evaluation metrics that we can use? And they're all very different. If we're looking at health policy, we're talking about cost effectiveness, we're talking about DALYs. In the agricultural world and a lot of other investments, we're talking about cost of benefit, returns on investment. We've got different languages here. And then the third is around the kind of importance of agricultural growth and nutrition. What can we count on for agriculture? How do we make this message to the policymakers in the country? And how is that going to change, that story going to change over time as they move forward in terms of their economic transformation? Finally, I wanted to say a few words, this is the last slide, about evaluation challenges. And I think we've all come upon this rather innocently, and this needs a lot more thought, okay? So if you look at the CGIAR model, it's really looking at kind of a system that moves from research inputs and investments of people and money to research outputs, okay? Those are then supposed to lead to outcomes, and then they're supposed to lead to impacts. And we kind of display this as a kind of linear model that moves forward, but it doesn't quite work out that way. So that's one kind of element. I think the other element is that now we're talking about, as we've discussed through the last few slides, kind of impact pathways and our theory of change, okay? So we have to overlay a kind of theory of change across this landscape of what we want to accomplish, okay? So one of the things from a research perspective is, on the left-hand side, you have the kind of the world that research can control and how we can look at our own internal performance and evaluation. And on the right-hand side, in the kind of slightly shaded area, you have how the non-research part works. And this is a kind of dynamic, evolving context. And how does research interface with it, and how do we evaluate the performance of research? Well, clearly one of the things we need to do is we have to understand the context and the dynamism of that outside world and have a theory of change that we can update in terms of how our clients and our partners are moving towards outcomes and impacts, because that's not us, that's not researchers, okay? And we have to be very clear about that. So there's a big part in terms of kind of understanding that change and evaluating it that research needs to be involved in, but it needs to understand incentives, institutional arrangements, a lot of things around that. And we have to understand the dynamism of the context. I think the other thing that research can be accountable for, and what we try and hold our researchers for, is do they understand who their direct clients are, okay? If somebody's doing evidence for policymaking, who are those policymakers? If people are trying to influence a national agricultural research system in terms of new ways of working, what do those clients need? And at least I can hold researchers accountable for understanding where their clients are and what they need. And that's something we can evaluate them on. And we can use outcome mapping tools or other types of tools for those proximal relations. But I think having a good understanding of what we're evaluating research on and what we're not is going to be very important. And obviously, what we're trying to do is get some clearer ideas for people who are funding us of how we're influencing, for example, outcomes and things we're calling research outcomes, where we have a more direct relationship with our partners, and then seeing how those can influence others. So we can be held accountable for our kind of research outputs. We should be held accountable to a certain extent for the influence we have the closer we are to the partners. And we should be held that our research is relevant and timely to the challenges that this context of the development implementers, value chain actors, and policymakers are facing. Okay, so I want to lay out kind of the evaluation challenge because I'm looking for thoughts from people here on that.
Okay, well, thanks very much, John, for that helicopter view of this challenging and complex program. What I'd like to do is to get the panelists, who we already mentioned are in at the heart of those 4 main areas of work. I'd like you, in giving some thoughts now, to really try and descend from 30,000 feet and get closer to the ground. And if I can just sort of give you a little bit of a prod in the sort of direction that I think it would be interesting to go for the audience that we've got with us today. John started out by saying that agriculture research and development has been pretty good at feeding people, less good at providing people with good nutrition. And I think that's a question which this program is endeavouring to look at and try and delve into. Now, it's interesting to note that I was reading something the other day, even going back 50, 60 years to the state of people's nutrition in Europe, when for obvious reasons of the Second World War, when those countries, many European countries, were extremely food insecure, their populations, certainly there are cases, in the case of Britain, I know this for a fact, the population of Britain came out of the Second World War in a far better nutritional state than it went in, because the state was in control of everybody's nutrition through a complex rationing system. Now, it wasn't a particularly good period for people. My parents tell me about how, what it was like to live on, an ounce of sugar per week, for example. That was your ration, but it was a balanced diet, etc. So it was state control. There were policies in place to get good nutrition to people, even under a case of severe limitations in the amount of food that there was. Okay, so that's an aside, but I think what it links into is what sort of policies, what sort of knowledge and evidence products can this program deliver, which will assist those people who are putting in place programs on the ground with the objective of improving people's health, improving nutrition, improving maternal nutrition, child nutrition, the 1,000 days, etc., which we all talk about. We all think about. I mean, I'm challenging you on behalf of the audience, and then the audience can come back and say whether they think those are particularly satisfactory answers. But let's just start. Let's not go in any particular order. Let's start at that end of the table, if that's okay. Tell us a little bit about the area of the program that you're involved in, and then try and home in on what are the sorts of things that we can expect over the coming period that we can use for actually getting impacts on the ground. Thank you.
Yes, well, I'm leading the component which deals with agricultural associated disease, so it's a slightly different focus from the nutrition, which is part of the other components. We've tried to identify where are the disease areas or domains where agriculture is most likely to make a difference, where agricultural research can contribute something. And those 3 areas which were identified were, first of all, food safety, which is a bit of a no-brainer. Agriculture produces food. A lot of food is unsafe. Unsafe food causes perhaps 2 billion illnesses a year. It has a major impact on human health. It also has a major impact on smallholders, poor farmers, poor retailers and food processors and makers of street food, and their ability to sell their products and to develop markets into the future. So food safety we see as a key area. Another area is around this whole area of zoonosis and emerging infectious diseases. zoonosis are the diseases transmissible between animals and people. Around about 60% of all human diseases are actually zoonotic. They pass from animals to people. And 75% of emerging diseases, the bird flu, the Spanish flu, the SARS, these are zoonotic as well. So this is another key area where understanding about how agriculture and agroecosystems support reservoirs of these diseases, which can then flow into people or can jump species from animals to people, can have a profound impact on human health. And the third area, which is kind of cross-cutting, is this whole, but which provides a justification for our work, is this whole area of One Health, eco-health, understanding the interdependencies between human health, animal health, and environmental health. So that's a quick kind of down to the 10 foot above the ground view of what we're doing. In terms of what we can expect, I think a key role for research is evidence. So we can come up with some of the convenient and inconvenient facts and truths about what agriculture is doing to both mitigate risk and to increase risk, and how we can then manage things better. And we can already see from some of our research how by helping people look at problems in different ways or do different things about problems, it can be clearly linked to reductions in the burden of human health, but also in the other burdens, the economic burdens and the other burdens associated with disease. So that's a quick overview from the perspective of health.
Okay, but again, just let me ask you one final follow-up question there, and then we'll move to Howdy on biofortification. So can you give an example of the sorts of things that you would, practically be able to say to somebody setting up a program, a rural development program or a policy program with the government, who would look forward to, this is something you're going to get from this program?
Yes, I mean, to give an example around food safety, as I said, food safety is closely linked to agriculture. We can help bring perspectives, two key perspectives, look outside food safety to the whole impacts of food and people's lives, and look beyond hazards to risks. And by doing this, for example, it might lead you from trying to, as was the case in many African countries, from trying to ban informal milk and trying to kind of prioritize a system which depended upon pasteurization and which excluded small farmers and which cost Kenya $26 million by excluding small farmers, and which had no benefit on reducing health risks because all the urban consumers boiled their milk, so it didn't matter whether it was pasteurized or bought from the hawker at the door. So that's sort of practical advice to change your food safety system to help small farmers to get cheaper milk to families. All win, no loss.
Okay, and that's actually an example which has taken place. The policy's changed and those benefits have been accrued. Okay, thanks very much for that. I'm sure there'll be more questions coming in. Howdy on Harvest Plus and its links.
Okay, thanks, Jonathan. Yeah, the basic idea of biofortification is using plant breeding to put more minerals and vitamins in the staple food crops in backgrounds that are just as high yielding and just as profitable as the current varieties. The reason that you have so much mineral and vitamin deficiencies in developing countries is because the poor eat a lot of food staples and they don't have enough income left over to buy fruits, vegetables, etc. So the basic idea is to put more vitamins and minerals in the foods that the poor already eat in large quantities. And agricultural research, you can make investments in one location, then you've generated this technology that can be made available to country after country. Once it's in the food system, it's available year after year after year. Traditional health and nutrition interventions typically have the same recurrent costs year after year after year. So that's the basic power of agricultural research. To make a long story short, we started breeding in 2003. So nine years later, we're beginning to release varieties now. We've tested them and shown under controlled conditions that we can improve mineral and vitamin status with these crops. So in December of last year, high provitamin A yellow cassava was released in Nigeria. So farmers are starting to grow now the high provitamin A cassava. This includes a 2 to 3 year period during which the government agencies test the agronomic properties of these crops before you can get release. High iron beans will be released in Rwanda this month in June. We're already distributing, we will be distributing seeds. We're already multiplying. We will be distributing seeds this year after the official release. High provitamin A orange maize will be released in Zambia in September of this year. We're multiplying seed, and farmers will grow the orange maize. We'll plant the orange maize for the first time in November of this year. We have a high iron pearl millet in India, and the packets of these seeds started being sold in India last week through the Nirmal Seed Company. In 2013, 2014, our high zinc rices and high zinc wheats will be released in Bangladesh, in India, and in Pakistan. We hope that by the beginning of 2014, we will have already given about 1 million farmers packets of biofortified seeds across all those crops. And our goal by the end of 2018 is to reach 50 million people with biofortified crops. We estimate that about half of those people will suffer from mineral and vitamin deficiencies. We're targeted on iron, on zinc, and on provitamin A.
Okay, can I just a bit of extra detail? Yeah. If somebody in those crops which are being released, so to an ordinary, farm household or consuming household, poor household, they end up eating high iron beans and high provitamin A cassava. What's their sort of percentage increase in nutrition from doing that, and are there any sort of specific health impacts that you've been able to detect from somebody just even maybe not even knowing that they're eating it, but getting the better nutrition that you're explaining in this way?
Right. On average, our target is to provide 40% of the estimated average requirement if you switch from the regular variety to the biofortified variety. It varies from country to country, but say if the population is already eating about 50% of the estimated average requirement, then we're making up the other half that people are not already eating. What we have been able to measure thus far is that the measure of the iron status or the vitamin A status improves after they've consumed the biofortified crops. Other studies have shown that if you improve the micronutrient status, then things like cognitive abilities improve, mortality goes down, morbidity improves, these sorts of things. In our impact studies, after the crops are adopted, we hope to be able to measure some of these things, but we haven't been able to do that directly yet. Okay. We have been able to measure the micronutrient status improves, but not the outcomes that result from the improved micronutrient status.
Okay, and final point, because it's a technical point, but I'm sure there are people that would want to know the answer to this and maybe afraid to ask. Are you working with any sort of genetic modification? And tell us what's happening with golden rice.
Okay. Yeah, you can use either conventional methods or transgenic methods to produce the biofortified crops. Harvest Plus took a decision early on that we'll only work on conventionally bred crops, just because we just don't want to deal with all the barriers and hassles of introducing transgenic crops, not that we consider them dangerous. With golden rice, it's not run under Harvest Plus, but it's being directed by the International Rice Research Institute. They have now put the vitamin A genes in high-yielding backgrounds. They're applying they want to release golden rice for the first time in the Philippines. So they're in the process of applying for release, permission for release in the Philippines. And I believe they expect to get that release in 2013 and then to begin distributing the golden rice in 2014.
Okay, thanks for that clarification, Howdy. That's very interesting. Marie?
Somebody else who's not good with names.
I'm hopeless here.
So the component that I'll be talking about briefly is related to the program's integrated agriculture, health and nutrition program. We start with the premise that agriculture development programs. So we're here focusing on the kinds of agriculture development programs that we're talking about, that where we feel that there is actually, if there is any evidence, it's that agriculture alone doesn't really improve nutrition. There's been several reviews in the past decade that have shown very modest effects of agricultural development programs on a series of outcomes. And although many of the improvements we see are along the pathways to improving nutrition, for example, improvements in the household availability of food, improvements in income, improvements even sometimes in dietary quality, but all of that hasn't really led to much improvement in nutritional status. So the conclusion from all of this is that we really need to do things differently if we want to improve nutrition through agriculture. And there is enormous potential, but how we get there has not been probably done perfectly up to now. And even if it has been done well in some cases, we just don't have the evidence because programs have not been evaluated properly. So we're trying to generate this evidence by first focusing only on integrated programs. We're not going to be working on agriculture programs that either don't have any nutrition or health goals or interventions. It's not enough to just measure nutrition at the end if you didn't have goals to start with and nutrition goals and specific interventions to improve nutrition. We know it's not going to happen by miracle. So we work with programs that are committed and already working on integrating agriculture, nutrition, and health, and very often it's mostly focusing on integrating nutrition interventions, but having also the link to health services, the primary health care kind of services. Focusing very often, these programs focus on women. They target women. We're talking here about the homestead food production system, the home garden, the programs that keep women close to home so that they can take care of their children while producing, and then ideally, if they have excess production, sell in the market. These programs usually have a strong behavior change component so that mothers don't learn only about agriculture, they also learn about how to adopt optimal feeding practices, and also they learn about the importance of taking their children to the health centers and getting them immunized and all that. So that's the kind of programs we're working with. We focus on as I said, generating the missing evidence. So we work on rigorous impact evaluations. We work the programs right at the beginning, at the planning stage of the program cycle, to make sure that partners, the implementing partners, be it governments or NGOs, are involved from the beginning and even defining what the research questions are. What do they want to learn from this? What is it that they feel they need in terms of information that will help them strengthen their program, design them better, and we do this extensive discussions with the program implementers before we start. We also develop a program impact pathway so that we all agree on what are the hypotheses there, how do we think we're going to get to these impacts, and how do we measure along the way whether or not these different pathways are being implemented properly. So we do process evaluation and operations research. So we develop these extensive program impact pathways and measure them and document what works and what doesn't work in what circumstances. We do focus on the 1,000 days, but agriculture programs don't focus just on the 1,000 days. They focus on everybody who can do agriculture. So there are still some tensions with program implementers about understanding how you manage to focus on the 1,000 days while not not working with those who don't have children and mothers. There's a real issue. So there are lots of questions about how to run those programs, how to implement them, how to evaluate them. And the last thing is that we will generate a lot of tools and methods for evaluating these programs properly. As I said, from even helping them design, we sometimes do formative research to help them design the programs. Then we do the baseline, the implementation research, and then we do cost analysis as well. This is a very important issue. Is agriculture a good way to deliver nutrition? Is not only looking at the impact, but it's also looking at what cost. There are lots of good interventions in nutrition that are in bad need of a delivery system. So is agriculture a really good delivery system for that or not? So what we will generate is first of all, evidence, badly needed evidence that these programs are worth investing in, that integration is useful, successful, leads to greater outcomes and greater impacts. And we also are designing tools and methods to evaluate these programs, which again are needed for researchers as well as to some extent by program implementers as well. So we want better, stronger programs that have what they need also in terms of information on what can help in terms of scaling up the programs. We're usually evaluating programs at a relatively small scale, but we need to generate information for them to know what will it take then to blow them up, replicate them, and scale them up. And then, as I said, the methods and the tools for monitoring and evaluation of these programs.
Okay, thanks very much, Mary, for that. That's very interesting. You're sort of in that tripartite world of agriculture, nutrition, agriculturalists, nutritionists, and health professionals. Now, I understand, I think you gave a very clear explanation that you're doing sort of programs, pilot programs, because that's where you need to develop those tools, etc. Maybe you could just mention to us, how have you, what's your secret for success of bringing those three communities together, albeit on a small scale? But clearly, part of scaling up is how does it work when you've got, three monstrous ministries that don't talk to each other?
Yeah, and I guess we're not there yet. The secret really is in the hands of the implementers, and what we're trying to do more than anything is document what seems to be working and what isn't working. And I must say that bringing nutrition, health, and nutrition, bringing agriculture, health, and nutrition together is working quite well, and agriculture programs often have these components. There are NGOs like Ellen Keller Concern Worldwide, Save the Children, they are implementing these programs. Where it becomes tricky is when we start looking at what in the program pathway is actually working and what isn't. What we find is that the agriculture part is usually going very well. The extension services, the knowledge people acquire about how to plant, and it's the same for the Harvest Plus evaluations that have been done of orange/sweet potato, where the agriculture part was happening, people were producing the food, were consuming it. But then when it comes to the link with the nutrition behavior change component is where we find that this is what they're not learning much about. And so that analysis of the impact pathway makes us always, everywhere we've done it up to now, find that this is the weakest link here, and we need to strengthen that. And how to strengthen that? What does it take? People that teach about or that do behavior change on nutrition usually don't come with seeds, they don't come with anything to give to the household. They just come and mothers have to listen to them, and it's a very tricky area. We're working with people that are developing this famous M-Health, mobile health. So using mobile phones to develop new methods of delivering the nutrition and health information and education. But this is the part that is usually weakest. And in terms of scaling up, I have to say we have very little experience to date. And again, programs have a lot more experience than we do. But they don't necessarily document this. And so that's where we're there. We need to work with them because without the programs, of course, we have nothing to say. But they have a lot that they could have said up to now and haven't, and we're finally there to catch this learning and document it.
Okay. Thanks very much indeed. That's very, very honest to understand. But you need to be honest to address the challenges. Thank you. I thought that was very insightful. Nutrition-sensitive value chains. What is that? Just like anecdote from me while you get your breath. I sent my daughter came to the supermarket with me yesterday and said, I want to get something up this aisle, and I said, oh, okay. I imagined that she was going to go up the aisle and get a jar of Marmite, which we'd spotted as we walked down. In America, they do sell Marmite. And she came back to my horror with a jar of marshmallow fluff. Does anybody know what that is? It's like a goo made out of corn syrup and sugar. Anyway, carry on. I wasn't impressed by that particular value chain.
That is just a great segue. Well, I think because John said that this is the least developed component, and so this is a place where we really need to build the evidence base. And why are we building the evidence base? There's this we all know that we need a healthy diet diversity. It's actually true, even though we're not working on the dietary transition and the double burden. That's true for the development of diets. It's true here. We need a healthy diet diversity. It's true in low-income countries. Interestingly, diet diversity is related in a positive way to the reduction in childhood stunting. It's critical to nutritional improvements and outcomes, but ironically, at least at low income levels, it's not closely related to income. In other words, it takes a huge income boost for some countries to get to dietary diversity. And it may not always be closely related even with average calorie intake. So it's a piece of the nutritional puzzle that's complementary to what Howdy's been working on for many years with biofortification. So when we're talking about diet diversity, what are we talking about? We're talking about foods like fruits and vegetables, livestock or fish products that often have high relative prices that limit demand, limited seasonal availability, may have quality issues, importantly may have food safety risks that are a limit to consumption or a limit to the expansion of markets. In areas closer to urban markets may suffer from competition from calorie-dense foods when those are introduced. And finally, from a lack of consumer knowledge. And so the value chain framework allows us a nice way to approach this in an interdisciplinary manner. By looking along the value chain, you can think about what are the barriers and constraints to developing markets. What are the places where nutritional value is lost or where risks are introduced? And then how can those barriers and constraints be addressed? And the research paradigm is to address them both from the supply side in terms of barriers and constraints as well as from the demand side in terms of building demand and awareness. So that's the concept, and our goal is to increase the nutritional content of foods delivered by value chains and enhance the demand for nutritious foods among the poor. So you had wanted some specific stories, and we have perhaps fewer stories and more need for story development in this component than others. But, let me try by giving you a story from the past that has been documented and published, and then a couple of the things that we're currently working on. So a story from the past is some work on beans in Rwanda and Uganda that I believe CIAT and the Dry Grain Pulse Crisp, the USAID funded group worked on. And they worked at all stages in the value chain, from improving the yield to addressing processing and storage that might result in changes there that would result in enhanced palatability and taste and reduce losses. Tried to increase market access and demand. Worked with women in terms of recipes families even and education about the role of beans in diet. So it was an integrated approach across the whole value chain. So that's a nice example. But moving forward, we're working, Marie actually can speak to this project with dairy value chains, for example, in Senegal, where the issue of sustained supply is being addressed through, potentially, in an experiment through nutritional incentives to the women who milk and supply milk to the markets. So as a way to both enhance the market supply, the connection of the poor households to markets, but at the same time to be educating them about nutrition and providing enhanced consumption of the nutritious food that they're already producing. A somewhat different example, Bioversity has worked with minor millet growers in India, and that's an area where cassava has become a more profitable crop. But the minor millets have this protein advantages. And so by working with the MS Swaminathan Foundation and villages there, we're working to develop some minimally processed products that could be marketed in urban areas that have nutritious properties, such as a malted millet product, and that way to get some value added and create continued incentives for the production of these minor millets, both for their biodiversity benefits as well as for the benefits to the households in terms of consuming those grains. So those are some simple stories, and moving forward we hope at the end of the first year to have some stories at least about the potential connections between nutrition and value chains for mangoes in Central Africa, traditional African vegetables in Benin, potentially fish in Bangladesh, and then working with ILRI to look at where there are opportunities in terms of food safety and value chains for some selected areas where they are working. So it's still under construction in terms of how to bring those elements together, but I hope those stories have kind of given you the flavor of what the component is about.
Yeah, thank you. Just one quick follow-up from me, because it struck me as you were speaking that there hasn't been a lot of talk about, or other than maybe talking about breeding companies and seed suppliers, hasn't been a lot of talk about the private sector in doing this. And maybe you could comment or give a view on whether you think that the value chain approach from a nutritional perspective, which you're working on, is where you have scope for working with food processors, food retailers, etc. You know, as the food system becomes more, you know, even in developing countries, more a model based on supermarkets and semi-processed or processed food, what scope is there for research there to enhance nutritional outcomes?
Right. Well, obviously, the key, there's been a lot of work, both at IFPRI, at the World Bank, many places, about connecting smallholders to value chains for export markets, for emerging retail markets, and for those income enhancement opportunities. And so the challenge for us is to build on that work and move forward and understand how to build value chains for informal markets that supply poor households, to what extent the private sector can be leveraged in those markets. For example, in dairy, which of course is kind of scale and processing and marketing, there's and where the Senegal project is working with the processor, there's obvious scope. I think in the food safety realm, one of the big questions is, of course, how something like standards for export in a fish market may spill over positively or negatively into the domestic market in terms of the quality and safety for low-income domestic consumers. Understanding how you might leverage that enhanced value in the export chain for a positive outcome.
Okay. Thanks very much.